Are there new treatments for relapsed Ewing sarcoma? Are there new treatments for relapsed Ewing sarcoma? Yes, there are exciting developments in this area, reflecting ongoing research and clinical trials aimed at improving patient outcomes. One established treatment for relapsed Ewing sarcoma involves high-dose chemotherapy combined with autologous stem cell transplantation. This approach uses intensive chemotherapy to eliminate cancer cells, followed by reinfusion of the patient's own stem cells to restore bone marrow function. Research shows that patients who respond well to chemotherapy and undergo this transplant have significantly better survival rates compared to those who do not receive a transplant. Some studies have even explored tandem transplants, where two sequential stem cell transplants are performed, showing promising results for certain patients. In addition to established methods, new targeted therapies are being developed and tested. One notable example is elraglusib, a drug that inhibits glycogen synthase kinase 3 beta, which has received rare pediatric disease designation from the Food and Drug Administration for Ewing sarcoma. Early-phase clinical trials combining elraglusib with chemotherapy agents like topotecan and cyclophosphamide have shown encouraging results, with prolonged and durable responses in pediatric patients with relapsed or refractory Ewing sarcoma. These results have prompted plans for further phase 2 trials and discussions with regulatory agencies about potential approval pathways. Another area of promise involves combining targeted therapies with standard chemotherapy. Regorafenib, a tyrosine kinase inhibitor that blocks signals essential for tumor growth, has shown some activity as a single agent in relapsed Ewing sarcoma. Recent studies have tested regorafenib in combination with standard chemotherapy regimens in newly diagnosed patients with poor prognosis or multimetastatic disease. Early results suggest that this combination is feasible and well tolerated, with plans for larger phase 3 trials to compare this combination against chemotherapy alone. In summary, treatment options for relapsed Ewing sarcoma are evolving beyond traditional chemotherapy and surgery. High-dose chemotherapy with autologous stem cell transplant remains a key strategy for suitable patients. Meanwhile, novel agents like elraglusib and regorafenib, especially when combined with chemotherapy, representing promising new avenues currently under clinical investigation. These advances offer hope for improved outcomes but requiring further validation in larger clinical trials. Patients with relapsed Ewing sarcoma should consult specialized oncology centers to explore eligibility for these emerging therapies and clinical trials.